biohacking, performance, mastery, mindset, holistic health. This is a show about getting better every single day. I'm on a mission, guys, to help over 1 million people get healthy and lose weight. Why? Because when you lose weight and get healthy, you have higher self-esteem. You have more self-confidence. And that person goes out and crushes their goal and starts living the highest version of themselves, and then they have way more impact on the world. What's up, guys? I am super excited and pumped to have my guest here, Dr. Jacey Folkers. He's a doctor of chiropractic, functional medicine practitioner, author, educator, co-founder of a great company, Blokes and Joi. If you guys remember, I interviewed the co-founder, another CEO, Josh Whalen, a while back. We were talking about TRT, hormone replacement therapy, peptide therapy, regenerative medicine, all that kind of cool stuff. He does it all. And after interviewing Josh said, you got to interview this guy because he goes way deeper than me. And actually, Dr. Jacey, you told me the same thing. I said, what are we going to talk about today? You said, believe me, I go way deeper than what Josh is going to do. So I'm pumped to have you on. Welcome, brother.
Thanks a lot for having me. I'm super excited and just want to do whatever I can to educate and share as much of this information out there as possible about whatever you want to talk about, whatever, what I feel like this stuff needs to be heard. So.
Yeah. We were just chatting backstage too, just talking about, like you said, it's all about the mindset, the health, the lifestyle. Yep. It's not, you're very, I think, bullish on a lot of this regenerative and some of these hacks and new medicines. And so am I. I think TRT is great, but there is no hack. I think my show is called The Hacked Life, but I still say there's no hack for mastery. And when you want to be great, the hacks are great because it starts the conversation and it starts to nudge you in that direction. But if you want to be a true master and you want to be great, you've got to dive into mastery. That's what it's all about. So
100%. Yeah. So in talking about touching on TRT, so testosterone, I think to start out with that, one of the biggest, I feel, misconceptions there is about that is, a lot of people, when you ask them about testosterone, first of all, they think it's just a sex hormone, that it's just about libido and or strength or having muscle mass, which those are significant. So a lot of guys are like, I'm good down there, man. I'm like, I get hard as a rock, whatever. I'm good. I'm like, what? But the reality is testosterone is much more than that, and it does contribute to libido and muscle and that kind of, and fat burning. But it's also about mood, sleep, inflammation. So guys that oftentimes I'll ask, so are you sleep? Is your sleep like it used to be? Well, no, it actually isn't. What's your concentration like? Yeah, I have brain fog. I'm moody. So it affects mood. I feel kind of irritable. Focus. So it affects a lot more than just libido. Energy is another thing that's linked to low testosterone. And so and also testosterone is not just a male hormone. It's a human hormone. So not a lot of people realize this, but if you look at the female side of it, women obviously make estrogen and progesterone. But if you were to measure the amount of testosterone, estrogen, progesterone, women actually make more testosterone than they do estrogen and progesterone.
Wow, really?
Yeah. If you were to, it's different measurements. They measure it in different increments. So if you actually were to quantifiably measure the amount of testosterone they make, women actually make more testosterone than they do estrogen and progesterone. So just like estrogen is not a female hormone, men need estrogen just as much. So it's just different amounts. And so there's a lot of misunderstandings about those hormones. That's why we like to talk about it and educate people about it and why it's important to get those things checked, but also to figure out ways to optimize it. It's not always about testosterone replacement. Like you said, there are things we focus on is regarding lifestyle, diet, sleep, exercise. And if those things aren't moving the needle appropriately, then let's look at replacement. So that's kind of where it starts.
Yeah, you're right. And you got to have that full balance. I remember I was talking to a guy at the DNA company, and he was saying, this company just put a client that got referred to him just on TRT because they're like, oh, he just needs more testosterone, and he grew man boobs. because it
Yes.
wasn't, he didn't have a testosterone problem. He had a conversion problem. And it's funny because I had a client just recently ask for some help, and I referred him to you guys. Like I said, honestly, I think you're a better fit for these guys. I'm not the guy for you, because he had a functional. And so here's the thing, right? You got all these functional medicine doctors. And of course, that's where I go to. I love functional medicine way over the Western medicine. But some guys, I think, they're dabbling, right, in this function. They're
Right.
calling them functional medicine. And so he has a naturopath or something that he goes to, but the guy put him on testosterone because it was low. And then he doubled it, thinking, all right, well, this guy's going to, next month when we check it, it's going to be really high. And guess what? It was exactly the same, and he still felt like crap.
Wow.
So I referred him to you guys. I'm hopefully they get some help, because, like you
Absolutely.
said,
I appreciate that. Yeah. So to your point, so here's the thing. It's kind of like cowboy time right now. There's so many, I guess, TRT clinics popping up all over. And what's frustrating to us and to me is a lot of these clinics just more or less put most patients on a very cookie cutter program. It's kind of like, you come in, they put you on the same dose as every other guy they start. And another thing that's detrimental is they put a lot of these guys automatically on estrogen blockers. Okay. So just like you said, so chances are this guy came in, and he probably was more prone to aromatizing, meaning he converted his testosterone to estrogen, and maybe that's because just genetically, or he had more adiposity, which is what's going to drive up the aromatase enzyme. However, if you don't really monitor that guy closely, yeah, his estradiol can go up. Oftentimes, it can eventually start to level out, but you don't want to just blast a guy with a super physiologic dose of testosterone. That's why it's recommended to kind of start low, move slow. I'm a proponent of more frequent. If you're going to go the injection route, more frequent injections versus just one big blast. I mean, another thing a lot of these clinics do is they'll either just give a guy one large amount of testosterone once a week, or even once every 2 weeks. So it's kind of just, in my opinion, kind of not managed well. Like I said, they put everybody on the same program, but everyone is different, and that's why you really want to treat each different. Everybody comes in, and guess what? One guy can have on his blood markers a level of, say, 600 and feel great. Another guy can have a level of 600 and feel lousy.
Yeah.
So it's where you are. It completely varies from person to person. And I'll share this with you because it's something I've seen and studied. If you go back the last, say 30, 40 years, we've seen a steady decline every decade since the 80s in men with the average testosterone level. So it's gone down about 100 points every decade. So literally men today are like a fraction of what men used to be. You know what I mean?
Yeah.
So so there's a lot of concerning things there, but that's why we got to treat these guys as individuals, but not be so focused on the labs, because unfortunately, there's a lot more men out there that are hypogonadal, that are suffering with low testosterone. They don't even know it.
Yeah, huge. I love what you just said about the whole 1980s thing. I read a great book over the last year, Countdown, by Dr. Shauna Swan. And she
Nice.
talks, you heard about this book?
I've heard about that. I need to get it.
Yeah.
I think I see it back there. One of your, you got a lot of books back there. I love
got
it,
a million.
man.
Yeah. So she talks about this infertility epidemic, and really
Yes.
it's kind of geared towards women, a lot of the book.
Right.
And but she also has, I think, I don't know if there's a chapter or just like, probably a whole chapter, I can't remember now, on testosterone and men also being part of the problem, and sperm motility. When they go back to like the 1940s, sperm banks, the qualifying amount of sperm that there was normal was like 70 or 60 or something like that. And now it's 15. That's the new normal. And she says the same thing what you're saying is just with this declining men are becoming, everything you said, I guess more estrogenic is what I'm going to say, but maybe that's an incorrect term. But they're not there's not enough testosterone going on there, and women the same thing. They all are relying on IVF because they can't get pregnant. And she credits a lot of this to the estrogens, the plastics, the heavy metals, all this stuff that's in the air. So
I agree. I mean, if you kind of look at all those things that are a lot of it's environmental. I mean, and a lot of people don't talk about this. Yes, there's environmental factors that are affecting us now, glyphosates, right? What's the other one? Atrazine, the different herbicides,
Yeah.
the parabens, the plastics, the sunscreen, all the different stuff that our bodies are taking in is affecting us and is driving up those xenoestrogens, the estrogens that are not like bioidentical. But also think about the epigenetic effect, like what this is doing to our DNA. We may not show now, but it's causing the next generation. So it's scary and it's concerning, but we're seeing this decline in fertility, in these hormones. And why are we focusing so much on testosterone? Why is it testosterone? Well, guess what? That's a hormone that is so important. It's a hormone that goes not into our cell nucleus, and actually impacts DNA. It impacts our genetic expression. So that's why it's so important. And so that's why if you're messing with these, if all these environmental factors are causing a decline in men, or feminizing men, or however we want to term it, it's affecting not just us but the future generations. So it's something we should take more responsibility in, I feel.
Yeah, huge, brother. Hey, man, we just started jumping into this thing, but I want to know a little bit more about you, and I think the audience would love to know too. Like, how'd you get here? Like, what is there a pain to purpose story? You're a chiropractor, but you have such a wealth of knowledge, and like, what kind of got you on this path, and then maybe really just into the hormone and regenerative side where you are now?
Yeah, so there's a lot of different stories that kind of dovetail into other stories, but I guess if I were to go back, Joel, I have 6 daughters. So my second oldest daughter, when she was around 5 years old,
by the way, I got to cut you off. 5, were you just like, all right, number 6 going to be a boy, and then I promised
100%. We thought, we were like, my wife and I were like, we're not even going to find out. We know it's a boy.
Yeah.
I mean, the pregnancy was so different. I'm like, sweet, I'm going to have a boy, and I was like, another girl. Oh, so I guess I'm just meant to be a girl dad, 100%.
Yeah.
But so my second oldest daughter, Callie, so she was 5 years old, and we were at the beach. I noticed she was playing in the sand, and I noticed a white patch on her back, and I looked at it. I'm like, interesting. So went and got it checked, and it turned out she was developing vitiligo. So it's an autoimmune condition, affecting her skin. And I'm a doctor of chiropractic, so I'm all about like natural ways. So I'm researching and everything I found online, and even the doctors, there's no cure. There's no cure for this. There's nothing you can do. You can put some cortisone cream or whatever. And so I'm like, no. And so I'm, stubborn. So I just started kind of just like trying to really do everything natural, flood her body with nutrients. And over time, she was getting on her face, and she was getting it everywhere else. And over time, it was resolving. I'm like, sweet. And so, but fast forward about, I want to say probably 8-9 years, she started developing symptoms of hyper thyroidism, which she actually was diagnosed with Hashimoto's as a teenager. So here I am, have a daughter that's an autoimmune. Has autoimmune conditions hitting her left and right. And so I just got very passionate in understanding what causes autoimmunity. And so lo and behold, my stepdaughter was diagnosed with type 1 diabetes very, very soon after. Then my wife was diagnosed with celiacs, and then boom. So next thing I know, I'm put on this planet to help people with autoimmune conditions. So I really started to get really deep into this, and that's what I practice for. I still, treat patients with autoimmunity, hypothyroidism, and it all goes to the, health of the gut is where everything seems to kind of manifest. And then this will, as you learn, cortisol and all these different hormones are like a symphony, and every hormone affects every other hormone. So I really started kind of getting deeper and deeper into hormone optimization. And then, but I'm the type of guy, I work. I'm so passionate about this. So it was my own detriment. My own health started to decline, and
I can totally relate. That's why
right. And so I'm like, not feeling the energy, difficult to get up in the morning. I mean, this is like working, practicing and helping people. And I'm like, man, I'm just getting it. And so I went and got my hormone levels checked. At the time, my testosterone was like 450, but the doctor I went to said, "Oh, you're good." And I'm like, wow, I really don't. Yeah. I don't feel good. And so, just rest, get more sleep and all that kind of stuff. So, and I'm like, this is to me at the time, this is not. I feel like he's missing something. I feel like I could benefit from potentially so I try to do everything I could naturally to boost my testosterone. And some of the things worked, but I kind of kept reverting back to feeling kind of tired and burned out and that kind of a thing. A lot of my other male patients, same thing. Their levels were like 450, 500, still feeling the same way. So I finally found a provider that got me on some TRT, and woo, overnight I felt like night and day different.
Wow.
So that's a kind of just the short, I guess, long story short version of it. But since then, been very passionate about just anything. I'm a chiropractor by trade. Worked with a lot of patients that have joints that just keep hurting and that kind of a thing. Testosterone has been helpful with that. I've always worked into the regenerative therapy, the regenerative medicine side of it. So utilizing certain stem cell products and things like that. Anything that any tool that's out there that I feel can help, I gravitate towards and dabble with and test, and that's why I love this stuff, the functional medicine world, because I don't want to be handcuffed into just only treating a patient based on certain markers or insurance. I want to give that patient what I feel they'd need or something that can help them to optimize their health. And whether that's supplements, education, hormone optimization, regenerative products, whatever it is, it's there. God gave us these things to use, and so that's what we're here to do. So.
Yeah, brother. Amen. Hey, TRT and joint health and just like, that kind of like aching and pain. Why is TRT having a downstream effect where people are having less joint pain? I'm curious. Like,
yeah, so it's just a lot of the studies show that testosterone, there's an inverse relationship between testosterone and nociceptive response. So just pain itself, like higher your testosterone levels, you feel less pain, but there's also an inflammatory effect, and that's why, believe it or not, contradictory to some of the belief, even studies show that testosterone has been shown to have a cardio protective benefit. It helps the heart, helps the arteries, and that kind of a thing, because downstream, when you have optimal testosterone, it's going to some of it's going to be converted to estrogen, which the estrogen itself is also cardioprotective. But it just, testosterone has, like I said, it has that anti-inflammatory component. It's going to reduce pain. Low testosterone guys with low testosterone have more pain, experience more pain, complain about more pain, have more joint stiffness. So they're less likely to be active, to exercise. So that itself. So as you know, movement also helps. So it's like what comes first, but the testosterone kind of gets you moving, and then that movement helps reduce pain and helps improve functionality. So it kind of creates like this great kind of pattern of testosterone, less inflammation, more movement, less pain, etc. So
yeah, I think something I mentioned with Josh too on the podcast was testosterone. The highest amount I thought was actually found in the heart. The highest amount you can find concentration of testosterone, and that, man. Then I was thinking, I asked him, well, wouldn't this be a good thing for this virus that we experienced the last 2 years? Because there was a lot of cardiovascular effects on the endothelium that a lot of people were experiencing. And I'm wondering, would you echo that? Like, or you guys saw some good effects when people, because it has to, right? If inflammation is coming down, then it would just make sense.
Well, let's talk about just inflammation, especially like obviously that virus blasted us with a lot of inflammation. You have inflammation, you're going to have a tremendous, obviously usually a release of cortisol. Okay.
Yeah.
Cortisol is your body's most powerful anti-inflammatory that's released in response to inflammation, to stress, all forms of stress. Obviously that's a crazy stress on your body, this virus. And so but the real antagonist to testosterone is cortisol. So you're having this high chronic cortisol release, testosterone is going to go down, 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 down. And so it's that kind of constant suppression of testosterone and which is going to, create this, like, I feel can contribute to that long-term effects of the symptoms of the virus. So to get you on testosterone, it's going to be all the more going to probably help mitigate those symptoms and, help promote healing.
So on that note, long haulers, Have you guys seen any good effects over the last couple of years? People are like, man, I'm coming to you, I'm just fatigued. I got this what quote unquote long hauler syndrome. And then yeah, they check out their testosterone, it's low, you bump them up, and then the next thing you know, they don't have that. I'm just curious. I mean, that would tie right in.
Yes.
Any stories
Yeah,
there?
yeah, yeah, yeah. It's interesting. So we have come across some patients that have just had like the long drawn out COVID symptoms, and we have peptides that can even help optimize that. As you know, like no two individuals seem to have the same symptoms, the same
Yeah.
long. Some people it could be more of the cognitive brain fog that just lingers. Some individuals could be just chronic pain, fatigue. And depending on what it is, like we could onboard certain peptides that say, oh, you're suffering from constant brain fog. Yes. Well, let's try something called CMAX, which is going to help stimulate and increase blood flow to the brain, get those neurons firing. Also, like what? It's a nasal spray. That's why I did. So
Yeah. I knew of it, and I was like, when you mentioned, I'm like, God, I've been dying to try that. So
yeah,
I'll have to order some from you guys.
we'll get you some for sure. But it's like all of a sudden, like the light bulb just turns like, wow, I just feel like more mental clarity and that kind of a thing. Other peptides that are great, they help with the immune system and help heal the gut. BPC-157 or thymosin beta, things like that are great for helping optimize just the immune system itself. And once again, it just helps pull that patient out of that that constant inflammatory cascade and just kind of turn that whole thing around. So testosterone too is part of that. So it's just that's kind of like I think the foundation. But people that have these specific symptoms, we can throw things at them that kind of help improve.
Yeah, really quick, because I do want to talk about peptides, but you're talking a lot about just the HRT and everything. I want to just address, like, and we talked in the beginning of the show about some of these doctors, and they call themselves functional medicine doctors, and they're just kind of dabbling and they're not dialing people in right. When you think of that, like, what do you think separates Blokes.co and Joi Wellness, the two companies that you and Josh oversee for HRT peptide therapy for both men and women? Like, what makes you guys different and unique, and why you're changing the game?
Yeah, so we really, we really follow like the literature that's out there that shows the real benefits of testosterone replacement, of how to do it right. And so here's some of the things that I would look out for if you're thinking of doing TRT. Obviously, you want to have somebody that kind of knows how to read the labs, but however, these lab numbers, first thing I'll share with you is these lab values are out there, are designed to disqualify a patient from starting TRT. Meaning, like I said before, so one guy can feel great at 600, one guy can feel lousy at 600. It's all individualized. But the reason those markers were put out there is because the insurance companies won't cover it unless you're below 300. It's kind of ridiculous.
I thought I thought it was even like the normal range was like 200 to 1200.
Whatever the lab core, and all this range has decreased, or like I said, over the last decades after decades, just keeps going down, down, down. Yeah. But the first thing is you're being compared to other low testosterone symptomatic men. You know what I mean? And so it really is. It's like Joel, do you have symptoms of low testosterone? Yes, I have this. Well, then I feel I know it's going to benefit you, so I don't want to deprive you of that. So the first thing is we want to kind of qualify a patient based on symptoms, based on the individual. Use the labs as a guide, and we want to dose you appropriately, not give you a certain dose once a week or once every 2 weeks. I'm more I'm a proponent of frequent dosing. So most of our patients are injecting at least twice a week, smaller doses, twice a week. Most of our patients are not on any type of estrogen blocker. Blocking estrogen has been shown to have a lot of negative effects, from a cardiovascular standpoint, from a cognitive standpoint, from a libido standpoint. If you block estrogen, your libido goes in the tank. In fact, if you block estrogen, you may notice the orgasms are like, what was that? It's like not even it like doesn't even happen.
Wow.
If you block estrogen, you're going to have achy joints. If you block estrogen, you're almost setting yourself up for a potential future cardiovascular event, because you're blocking the protective benefits of what testosterone provides, which is that healthy metabolite, estradiol. So we don't block it. We don't want to block something that we know is going to be helpful and beneficial for the patient. We also don't block DHT. Everybody's like freaking out about, okay, if I take testosterone, I'm going to go bald. And you know what? It's like people think if I get on DRT, I'm going to go bald. You're going to go bald either way. I mean, it's like the real, I guess, way to fix that is to choose better parents and choose better genetics, right? I mean, that's really, you can't. It's in our DNA. If you're gonna lose your hair, I mean, it's just it's just part of it's in the cards. Testosterone might to some degree accelerate that, but it's not going to like cause you to go bald versus not. So
Right,
I don't believe in blocking DHT. I don't care if my hairline recedes like crazy, but to me, it's like that is how you feel is amazing. So that's another healthy metabolite of testosterone. But once again, it's about being dosed appropriately. So if you're taking it 2 or 3 times a week, smaller dose, split dosing, microdosing, you're going to have more optimal DHT, estradiol, better hematocrit, better hemoglobin. All these values and markers will remain in a healthy range.
Yeah, and then do you guys, having said that, maintaining that healthy range, are you guys regularly then with your, because I don't know if people know, and if they can go back and check out the episode I did with Josh, but you guys are remote company. This isn't like I don't walk into your office. I think that's the neatest thing about it, what you guys are doing, and that you're on the roadmap to getting into all 50 states, and you have to get through all those hurdles with licensing and stuff.
Yep.
But you can get phlebotomists to go to the home, draw blood. It's like, that is really, really neat.
One of my, I'm so glad you brought that up. You're such a good podcaster, such a good interview. No, I'm glad you brought that up because, man, my biggest, I guess the thing I preach the most about and always do is I feel the future doctor is the patient. I want to empower patients to take as much responsibility in their health. And to me, it's like, yes, we're providing this virtually. We're shipping the medication to your house. We're teaching you how to inject yourself. We're teaching you, and we could use creams as well, but for the most part, injections. We're giving you the patient the control. We're helping you. We're assisting you. We're guiding you, and we're managing you. But yes, we can with the bloods. We have with the blood panels. We have lab corps we can send you to, Quest lab we can send you to near your home, or if you happen to be far from one of those locations, we can ship a test kit to your house, have a phlebotomist go to your house. There's really no barrier. We just want to make it easy and accessible for patients. But really, it's like empowering. Like, wow, this is like I'm feeling better. I'm taking ownership, and then it kind of like lends itself to like, you know what? I want to start exercising. I want to start. I'm doing this for myself. I want to start eating better. And it just, I mean, that's what we preach is we want our patients to take responsibility. And it doesn't just start with like, because if you feel like I have to go to the doctor's office to do whatever, you're kind of delegating your health to that doctor. You know what I mean? In the psychology of that is like, I want to move away from that and make it more towards it's in your hands and in your control.
I love that, brother. I one of my big missions too is anytime I do a lot of holistic weight loss coaching. And one of my big things with all my clients is, I mean, we're going to lose weight, but the bottom line is we're going to get you healthy first. And I believe everything I'm teaching them in these one-on-one practices is you will become, when we're done, pretty much a like certified health coach in your own home.
Yes.
And then you get to go impact your family, the next legacy of your kids and lineage, and the neighborhood, the community around you. So yeah, that's what it's all about.
100%. Yeah. And it's kind of, it starts with you. And like you said, it's oftentimes people, come up with excuses like why they're not exercising, why they're not making certain food choices. It's, whether they feel it's like a self-centered thing, but real, like, it's like, do it for your kids, do it for your grandkids, do it, befriend somebody that's doing something that you wish you were doing, whether it's, walking or going to the gym or joining some type of class. It's just start doing something, whether it's, for yourself or for someone you love. It's, it's only going to help everyone.
Yeah. I want to get into that, actually, what you just talked about, some of those lifestyle practices that you are just such a big proponent of. But one question I wanted to ask you, because you mentioned estrogen. Hey, we don't block estrogen. Yeah. Now, there is a lot of old maybe dogma, you could call it, or there's
Yep.
a lot of
Yep.
old, at least I can recall,
Yeah.
this Joel. You cannot take estrogen. It is going to cause cancer, especially with women. I'm talking about women, right? They
Yeah.
have high estrogen. That's what the cause of their cancer. What are your thoughts of that? Because I know with hormone replacement therapy, especially for women with Joy Wellness, maybe you can kind of speak on when they go into
Yes.
menopause, there's
Yes.
this idea, and I've seen with other practitioners, they actually use HRT, they supplement them with estrogen, and then guess what? They feel amazing again. They're like, oh my God,
Yep.
I'm not cranky anymore. But then there's the idea of estrogen causes cancer. You can't do that.
So good, man. I'm so glad. So, the probably one of the biggest I feel travesties in medicine for women is that Women's Health Initiative study that is what kind of sparked that whole like estrogen causes cancer. And there's a lot of it was heavily flawed, that study. They used like the horse urine form of estrogen. They used a synthetic form of progesterone. A lot of holes in that study, but it seemed to put out in the press that, oh gosh, estrogen causes cancer. Um, and it's since been proven that it is. I mean, I'm thinking of like my mother, for example.
Yeah.
I'm starting to see her kind of postmenopausal, moving around less, more frail like than she used to, and I feel like, man, I want my mom to be able to kind of be active with my kids, with her grandkids, and that kind of a thing. And it's my mom, I'm used to her being being active and that kind of a
You
thing.
want her to be thriving in her age, man. That's
100%,
yeah.
100%. And so it's like, to me, it's like I want her on estrogen, progesterone, even testosterone, because
Mm,
because when studies show it, I to some degree, if you just put them on estrogen, maybe that will lead to the thickening of the uterine wall, which you don't want, whatever. But you want to balance it with progesterone. So if you're putting a postmenopausal woman on estrogen with progesterone to support it and testosterone, man, we've seen it's changed these women's lives. I mean, especially the testosterone piece. This is what keeps these women out of the nursing homes. This is what
mm.
helps maintain bone density. It's that diminished drop down of these hormones that cause the osteopenia, the osteoporosis. When these ladies break a hip, it's devastating. I mean,
Mm.
we don't think about it now, but someone that breaks their hip, it's like their chance of morbidity in the next 3 years, their chance of death goes up significantly, and their quality of life is just not even close to what it was. And so, what do? You maintain that bone density oftentimes through hormone optimization, but also through exercise. So it's kind of a combination of all these things.
Yeah. I love what you said because I've heard Peter Attia, who's kind of a functional medicine doctor
Yeah.
himself and does a lot with the cardiovascular system. And
Yep.
I've heard him even talk about what you just said. He says when people are in their 70s, the greatest cause of death is that they fall, they break a bone. It causes them to be limped
Oh
up.
my gosh.
Then they have atrophy and they die because
Yep.
they can't get themselves off the ground.
Right.
And so he, I think he's just probably like in his early 50s or late 40s, and he's kind of like working on what he calls like the Centurion Olympics, and like I think he has like 5 moves, and that he's like, these are the movements that I need to be doing on a regular basis, so that when I'm older, I'm gonna be able to get myself up off the ground. I can hinge, I can
Yep.
deadlift, So
Yep.
he has some like I don't know what his top 5 are, I can't remember, but I think that's so crucial what you just said.
Yeah, and it's like, to that point, it's really one of those cornerstones of longevity, is maintaining muscle, maintaining strength. And a lot of us, how we identify getting older, I think a lot of people think, I'm getting older, I'm supposed to like shrivel up and get sicker, and it's like, no, if you start to implement these movements and these activities and these habits, it's only we're adapting to what we do. We can adapt to being lazy, sitting on the couch, yeah, and then that you will, retirement doesn't mean sitting around. You should be being active. I just saw something, what was it, this morning, about the senior Olympics that they have. Was pretty cool. There's this lady, she was 88 years old. She has like 50 gold like medals and she's doing like pole vault, like, shot put,
Yeah.
100-meter sprint, 88 years old and competing. And she's like, I can't wait till I'm 90 so I can then be in the older bracket. And you know what I mean? It's like, I love that. She's like
Yeah.
she wants to get older and just to continue to compete. And that's what we have to look at life like that. Like I'm going to continue to thrive and maintain muscle mass. And those movements, like you said, are what also help maintain cognition and prevent the dementia, Alzheimer's issues.
Yeah. 100%.
So,
I'm just curious too. Do you think, and this is maybe just more of a personal opinion, and then just based on what you see anecdotally and what you see from the wide range of patients that labs and everybody that you're going through, but do you think that, after a certain age, and I'm just saying like in general, or people want to thrive, like, hey, you probably should be on HRT. Like, is there an idea like everyone should be on HRT probably after 50? Not, and again, this is a generalization. I'm not saying this for everybody, but I remember being around a pretty smart PhD health practitioner. And I remember him telling me that he's like, dude, everybody after 40, he's talking about guys probably need to be on HRT. And I was like, really, this stuck with my head. And I was just curious what your thoughts are. And like what we just mentioned with women postmenopausal, I mean, or can people really, do you think, just supplement their ways through, supplements,
it's such a good question. And I think about that a lot, because I think about like we talked about in the beginning, if you were to go back 100 years, the average man's testosterone was way higher than we are now. And, we've all the toxins that we release in our environment now has affected us tremendously. We kind of ignore that, but yeah, like the man now is different than the man 100 years ago. So I almost think like, how can we counteract these things that we're doing to ourselves, like the stress and the toxins, and look at how much cardiovascular disease is killing us and cancer is killing us. And all those things both correlate with low testosterone. So for me personally, I'm on TRT and I know what it's doing for me. So I'm going to stay on it the rest of my life. And so, yes, I would on that point recommend at least getting tested, because you may be a outlier and be 50 years old and have a TRT of 1200 and be feeling great and good for you. But most of the guys are not that. And so, and here's the fact is, a lot of the things out there do get testosterone up to some degree, and there's a lot of marketing and a lot of money being made on the supplements and all these things, but they don't seem to move the needle enough to create that real beneficial effect that we're looking for. And I've seen it time and time again, because being a functional medicine doc for years, I've tried for we're talking
and
everything. I tried everything, and they're like, I feel little, and it's just like, even 2 years of aggressive, they're like, it's moved it a little bit, but I'm like, you know what? Let's try this. Just let's try this injection. Like, holy I mean, it's like it's a game changer. So it's like, there's some degree of fear, and like, once I start it, I can't get off of it. And that's true to the point where if you start TRT and it gets you to like 1200 and you feel amazing, and you decide, I want to get off it for whatever reason, maybe because your testicles are small and you feel like, I wasn't, ready for this small ball syndrome, whatever, and when you get off of it, and you're back, oftentimes you're back to where you started. It's not like it like completely shuts it down and you're now a prepubescent girl for some reason. You know what I mean? It's just oftentimes you resort back to where you start. But every guy, their testicles at some point will just kind of not have the same integrity and produce as much testosterone. Those cells, those Leydig cells, just kind of are bombarded by the oxidative stress of just the more years and decades we're on the planet. These things happen. So long story short, I think it's something that every guy should consider, especially in their late 40s and beyond.
Yeah. And this is not a plug for you guys go out and buy testosterone because you're my guest, but I was just curious because, and again, I think if you look back, like we were meant to, procreate and then die, right?
Yeah.
But that's not the case anymore. Now we procreate, like you said, we have a retirement. People are living into to be 100 years old, and so for me, it's just I question it too. Like, hey, I just turned 40. I want to, and I'm doing great, but I want to thrive. I don't want to be
Yes.
just baseline, and so I even question like, hey, at which point will I start, messing around and fiddling with some of this HRT and stuff? Because I do see a lot of value in it, and so yeah.
Yeah. One other opinion I have, I feel like it's, I, and this is contrary indicated to some other people that what they believe, and that's I feel like don't wait until you're 65 and you have the high cardiovascular risks and the high blood pressure and the potential insulin resistance and the prediabetes and that kind of thing, because it's oftentimes it's like then you're kind of like trying to reverse what's the damage. I like to always practice prevention, take a proactive approach
Proactive, yeah.
versus a reactive.
Yeah.
So to me, I'm doing these things and I take small doses of it, and but I exercise, I eat right, I do all the things from a lifestyle standpoint, yeah, I feel better than I have in a long time, and I'm all about adding vitality and life to my years.
Yeah.
None of us are going to live to be 150, but as long as we're on the planet, let's, like you said, let's optimize ourselves and let's be the best version of ourselves. And really, for me, it's all about protecting the brain, because that's really what it boils down to.
Okay, let's talk about that.
Yeah.
Because you mentioned that a couple times. It's not just hormone replacement therapy. It's exercise, it's stress, it's lifestyle, and you've had your own setbacks. We were talking about just the the neck injury and how you couldn't even go to the gym and do one single dip. And now here I am, you're tagging me in Instagram videos showing me how many push-ups you can do. And I did, by the way, try to do a couple push-ups. I was like, all right, I didn't do as many as you. I'm like, I'm not even going to bother sending back the video to show you my, I'm a competitive. Okay, next time I will, I promise. I'm a competitive guy. And I was like, man, this guy's just tearing me up. But yeah, I mean, you're out there, doing tons of push-ups, tons of dips. Kind of talk about that and why the mindset piece is so important.
Yeah, well, so like like we talked about before, so many patients have so many people just in general have excuses, and just like, why I don't have time, or I don't know what to do, and I don't know where to start. Well, like I had an injury probably 6 years ago. It herniated 3 discs in my neck, had a lot of nerve damage, and my like left shoulder, arm, part of the pec, it just didn't work. The muscles wouldn't even fire. So I was going to the gym.
By the way, I got to ask you a question. As a chiropractor, as a natural doctor, how frustrated were you just saying like,
extremely.
I get this is my life. I know how to fix this, and I can't fix this. Like, what was the conversation?
You know what? It was a double. It was like a blessing at the same time as it was a curse, because here I am, a chiropractor, and I have a neck that's worse than almost all my patients. But I'm like, I know what this feels like, to feel almost like where you can't function. I'm like, wow, this is what it's like to have a jacked up neck. I mean, here's the thing, Joel. I was consulting with surgeons. There were guys. I was looking into non-invasive procedures to maybe replace a disc and do. I mean, 3 discs that were like just it looked like a train wreck on the MRI, and I'm like, how am I gonna? How is this? How am I going to fix this? How am I going to? So I did a lot of it. I mean, I cut out anything inflammatory you can imagine, from any sugar. I mean, even I cut out caffeine. I cut alcohol. I blasted my body with anything that was anti-inflammatory, turmeric, curcumin, just boom, 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 and just really try to flood my body with nutrients. And over time, the pain that was like excruciating, like beyond belief, started to kind of go down and down, but I had no strength. I could not do one dip. I could barely do a couple push-ups. And so I would go to the gym and I would kind of like got myself to be able to do a dip. And I'm like, oh my gosh, like the muscles are starting to fire and I'm starting to, feel it. I started to incorporate blood flow restrictive training to also help. And I started really getting into that whole thing. And over time I was able to do, a few dips, and then get to 10, and months and months went by, and I kept using that as a barometer to test, to see where I was and my improvement. And I got to the point where I was doing 60, 70, 80, even 100 dips, at the gym. And then I'm like, I don't know. I think my brother bought my nephew a Guinness Book of World Record book, and we were looking at it, and my brother's like, I think you're pretty close to the world record in dips. I'm like, no, whatever. Well, then, long story short, I started training for this world record in dips, and with a 60-pound weight vest and doing or backpack and doing that, and I actually broke it a few times. I didn't get the plaque because as I broke it, then it got broke by some dude in Dubai, and then I was like, oh shoot. So then, but with that said, I was able to beat it a couple more times. But I mean, the mindset is I went from like not even knowing if I was ever going to be normal again remotely to just like, you know what, screw this. I'm just going to keep pushing. And a lot of it was just like imagining my neck healing, visualizing it healing, and just like even meditating on it and all that kind of stuff. All of it, and thinking positively and believing that, and just seeing that one dip that I was able to perform was a win. Just getting to 2 dips is a win. So the point is like getting your ass off the couch and going for a walk for 5 minutes should be a win.
Yeah.
And build on that. Do it twice a week. Start to do it 3 times a week. Make it, walk with your wife, walk with your kids, walk with a friend. Then get to like, hey, let's start to do some push-ups. Let's start to do some body squats and just moving your body. That's what we're designed to do. And your body will thank you for it. And you'll start to adapt, and your identity will change literally. Right.
Yeah.
So you'll start to like, well, you know what? I kind of want to, I kind of want to eat more protein because I heard that's good for building muscle, and eat more protein, you know, and so you start to change your identity, start to appreciate the feeling better and healing and what the body can do. And I definitely can identify with that from what I've been through.
That's such an amazing story because, you know, here I am expecting you to tell me, and I actually am going to ask you, were there any biohacks or anything else additionally that you did? But I'm with you. I'm in this, the more that I've gotten into health and coaching, really what I see is the biology of belief, like Dr. Bruce Lipton talks about, and metaphysics.
Yes,
I'm a
100%.
big proponent of metaphysics, and I see it in people all the time. And when you can actually, the mind is so much more powerful than any TRT or anything. And you put that in place, you're living proof of it. But what I also find fascinating in your story is just the consistency to continue to show up, because you were in pain you tell the story now and it's like, yeah, well, that was 6 years ago. But you had to show up every day and go, you still suck. You only can do 1 dip. That's a lot of people's mindset. And you looked at it really in a different way. It's like, yeah, I was able to do 1 dip. Holy shit, this is a win.
No, it literally, and I guarantee you, Joel, every single other person that gym could do more than I could do. You know, like my arm wouldn't even work, and I didn't think it ever would be. And it's still not 100% compared to my left. I can still take a dumbbell the same weight and
you're doing 63 dips in a minute. It's working pretty good,
right? It's just I still notice there's an imbalance, but it's like, you know what?
How do you want to live, right? That's right.
I want to keep working to balance it out. And so it's just, you know, it's like being able to have that challenge and that contrast is like, you know, I was here before I was able to, and I never in a million years, like I said, this was not like I'm going to break world records, you know, when I grow up. And this is like, I came across a huge challenge that I didn't think would ever, like I said, I didn't know if I was ever going to be able to do 2 dips, 3 dips. I just like, is this a permanent thing? Because you hear all these stories about people having nerve damage, and which I still have, but it's like that they're never the same. But I'll tell you what, the body can heal, and it did, and it's because I just kept using it, moving it, and it's like the adaptive process, the positive mindset, the giving it the nutrients, the protein, the electrolytes, and all these different things. Reducing inflammation, I think, was probably a huge thing. Incorporating blood flow restrictive, which I think is one of the biohacks. I really kind of dove into that. It's kind of like that's a way to trick your body into forcing it to get stronger, and all those things. Cold therapy. I've been doing cold therapy since before it was like the craze. I mean, this is like, saunas. We have a sauna in our house, so I do all the things. And it's just, and like I said, this isn't something that I've been doing since day one. It's like, it's little baby steps where you continue to add, as you know, you probably like, if you look back 6 years ago, you're probably doing, a fraction of what you're doing now, right?
100%, man.
Yeah.
I have all this gear and all these biohacks in my
Yep.
house, and you know what? I always tell people, none of it matters. Honestly,
None of it matters, man.
none of it does. It's all what's up here,
It
brother.
is. It's all up here, and it's all just moving your body. Like, I think we're just using these biohacks to kind of give it an excuse to go from here to there. But
Yeah.
I mean, speaking of which, just moving. Just, sometimes I'm like, I'm working on a computer, talking to patients and doing that kind of stuff. In between, I'll turn on music and I'll just sit and, because that, you just want to keep moving. Like, those little micro movements are huge in also helping burn calories and, keep your body burning fat. So
Yeah, you and I are both standing right now doing this podcast.
yeah.
And I do it on purpose, not for the burning the calories thing.
Right.
Although I love to tell my clients that's why I do it. So I try to be the model for them. But really, I do it because it's an energetic thing. When I'm sitting down, I'm slouched over, and my energy's weak. When I'm up here,
so this is back to my neck. This is why I always stand. Because when you sit, you tend to so if you slouch even a tiny bit, watch what happens to my neck when I slouch.
Oh yeah.
So versus I stand up, you see the difference? I couldn't sit for a year, bro. I couldn't even sit because of anytime I sat, it was like a shock of pain and numbness went down my arm.
Wow.
So posture is huge. Sleep is huge. The way how you position yourself when you sleep is way more important than people realize. There should be complete relaxation. People use pillows that are too high, too low. So all those things are like, so I've had to be like acutely aware of all those things just so my body could heal, and it did.
Yeah. Did you do any at the time, were you already messing with things like BPC 157, which we know is great for joints and healing? Were you able to do
that? Is what got me, that's what sparked my interest in BPC 157 was that injury.
Wow.
I also got injections of stem cell products that were derived from, I mean, it's all ethical. It was from a place so I got stem cells in my neck. I don't know if that really moved the needle that much, but it was pretty much everything else. And maybe it was a piece of the healing process, but I did everything, man, because it was the worst pain imaginable.
Yeah.
And like I said, I empathize with anyone that has a disc injury, in which it's the worst. There's nothing worse than having something putting pressure on your nerve.
I go back to what you said earlier about identity, right? Like, my identity is I'm a natural health guy. My identity is I'm a chiropractor. My identity is I'm in the gym. I'm working out. I'm pumping iron. I'm in good health.
Yep.
You just got your identity destroed, brother. It just went away from like that. And so when you lose that identity, it is depressing. And
100%. And not only that, like anyone out, like all the hard work you've gotten over the years from working out and seeing like your muscles, kind of your arms, your shoulders, your chest, it was gone. Like it looked like I had two different appendages. It completely atrophied on the right. It was embarrassing. Even my shirts were all loose on the right. It was the craziest thing ever, but it was like an amazing eye-opening thing, like how precious like health is and how it can be taken from you, man. It's so I don't take it for granted anymore. And just being able to do things with my kids and pick them up and throw in and have fun is like, I appreciate it. And that's why the stuff that we do, we understand like health is something. It's really where true wealth is something we don't take lightly. And it's not just about testosterone, but it's about what it can do to help get your lifestyle where it should be. So it can be that catalyst that like, wow, I actually have sex drive again. I actually feel like I did when I first met my wife. I'm chasing her again. And a lot of it starts with us, man. Like we need to kind of man up again. And it's unfortunate, but men are just like not men anymore. You know what I mean? So
actually, I don't. Tell me about that. Talk to me just briefly about when you say that. And the only reason I ask is because I've been really questioning. It's not something that I ever really thought about until just kind of more recently, and just listening to a lot of other coaches and coaches that work with dads. And I didn't really realize like there's this gap, I guess, where like there's like this, like what you just said, like dads not being dads not being like men and like being responsible. And I'm like, wow, I didn't really realize this was a huge problem. I'm kind of in my own bubble here, I guess,
Right.
tracing the dream of excellence. And I'm infallible, by the way. I'm not saying that I'm not. And I'm trying to improve as a dad myself, but the part of not being responsible and being a man and extreme ownership, I didn't feel like that was really the
Right.
big. So I'm wondering, what are you saying when you say that?
Yeah, I think it's. I guess I'm looking at it from a lens of a father because I have all daughters, and so I have nephews, so I live vicariously through my nephews because my nephews are all like amazing athletes, great football players, wrestlers, and I have all daughters, so like dance and cheerleading and stuff. But hey, I get it.
Yeah.
I rock that as best I can too, right?
Yeah. Yeah. Yeah.
But three of my daughters are married, so I'm like, in me, I see how the younger generation of young men are. I sense a little just more laziness, I guess I would
Mm,
call it. Kind of. I don't know if it's the
yeah.
social media or if it's the technology or what, but I do know, knowing that the endocrine system is in especially testosterone in men has been declining,
Yeah.
and that affects drive, that affects dopamine, that affects
Mm,
motivation. Testosterone and dopamine are kind of like Andrew Huberman mentioned, like cousins, if you will, and
mm-hmm.
and they kind of help keep you driven, focused. And if you have a decline on that, you see these guys are just kind of like, yeah, just kind of,
Yeah.
and kind of like that, just entitlement. I don't know, like
Yes.
when's this job going to land into my lap? And it's like, and I look at I know how my dad was. I hear how my grandparents were, and just
Yeah.
my grandfather, just driven, just good, hardcore working dudes. And it's like, there's just not a lot of those guys anymore, man. And I guess that's what I mean. But so I'm like looking towards the type of guy that I want for my daughters. I want a dude that's like Joel, like driven, like wants to take care of his family, be responsible, and take care of ownership of his health, right?
Yeah.
So
Yeah. I love that. Okay, that was
yeah,
awesome. Yeah, thanks. A couple more questions, and then I want to wrap things up because I mean, I'm looking at the time where I could talk to you all day, but I know just
heck
from
yeah,
doing this for a while, when we get to that hour point, people's attention span. And but I'm a big fan of the long episodes too. I know like the Joe Rogans, the Tim Ferriss, they do it for 2 to 3 hours, so
man, they go
they're
for a
going.
while, marathon.
But I'm happy to. I'm loving this. I mean, we'll definitely have to chat again. I wanted to ask you, are there any peptides or
Oh
anything
man,
new that's coming out, or maybe something that other than BPC 137? I think that's the next kind of generation of things other than stem cells.
right.
Yeah, but anything that is exciting you, or you're like, oh, this is coming
You
out.
know
It's
what?
gonna be pretty cool.
Yeah. So we kind of keep talking a little bit about like lifestyle, weight loss. The weight loss peptides are exciting to me. The one in particular, semaglutide, which is kind of like categorized as a GLP-1 agonist, which is what that is. A GLP-1 is what is secreted from the L cells in our small intestines when we eat, especially in response to carbohydrates. And so what this peptide does is, and I almost feel like the research and literature is going to start to come out how amazing this is just for a lot of chronic conditions, with regard the brain, the heart, PCOS, tumor growth. But it
Mm,
it helps suppress appetite. It helps control cravings because we have a lot of GLP-1 receptors in our brain. It helps with satiety. Because here's the thing: the reality is, if you look the last 50, 60 years in the diets and nutrition programs and blah blah blah, we've been like giving out to patients and people, they're not working. We still have obesity like crazy, more
hmm
than ever. Type 2 diabetes is an epidemic, and all these things are just going through the roof. Cardiovascular disease. This is an exciting peptide for me. GLP-1. So people, it was originally designed for like type 2 diabetics, and they found like, wow, this is a really great peptide for weight loss. People are losing weight. People are helping with appetite. People are starting to just not have cravings, and all the frustrations that they've had from like trying to do this workout routine, this diet. All of a sudden, they're seeing results. They're seeing like improvements in their circumference measurements, and on the difference, a change on the scale, things that they haven't seen in decades. And we even have a patient that literally, she said, in like 20 years she has not been able to say that she's not she's been under 200 for the first time in 20 years. So she's like, she sees 100 something, you know what I mean? So
Wow.
yeah. So for a long time, she's like, oh, I'm 265, 270. So she's lost like 100 pounds. And it's like,
Mm.
nothing else she said has done that. And we have a lot of other patients with success stories, but it's like, it's amazing when you have a product that works like that. And it's not a stimulant. So it's not like,
Hmm.
getting all revved up. But what I like about it is it's allowing these individuals to create habits that when they come off of the semaglutide, those are the habits they're going to continue to maintain to live that lifestyle and have that weight loss that they've gained they've obtained.
Yeah,
So
the
I'm
semi
really excited about that.
Yeah, that one excites me too because from what I've seen from the research, it's actually been one of the only. Well, I don't want to say it's a peptide, but it's been one of the only things that's really been shown to help with long-term weight loss.
Yes.
And that's the
Yes.
key. And actually, I just did every Wednesday I do like a weight loss Wednesday show, and I was talking about there was an article that came out why long-term weight loss fails, and I
Right.
was reading the article and I thought it was fascinating because it said, yeah, people lose weight, but the biggest problem is the leptin and ghrelin levels, which is your satiety hormone and your hunger hormones. And even though you lose weight and these things go down, they start to fluctuate again. And that causes people to overeat again and then put on
Yes.
all the weight. And so if you can manage those hormones, I would imagine, which is what semaglutide's
Yeah.
really doing, you're going to get some long-term good results.
Yeah, it's in a sense it's amazing because it's kind of in a sense resetting your metabolism to then to kind of help balance those other hormones, leptin, ghrelin, and it's amazing because you're seeing improvements in because you're improving insulin sensitivity. A lot of these patients who are insulin resistant are now kind of being more insulin sensitive. You're better utilizing glucose, and you're reducing inflammation in the arteries, and so you're having all these like great ancillary benefits. But as the best thing that people can do is eat less. And that's what it's helping people do with almost no effort.
Yeah. Any Well, actually, I want to ask anybody that doesn't know about semaglutide. They're going to ask, okay, well, what does that look like? What does a protocol look like? What do I have to
Yeah.
do? Is it like a 3-month protocol is pretty standard, and then what do you?
Yeah, great question. So it's kind of there's it depends. It's a case by case thing once again. So we have some patients, depending on how much weight they're looking to lose, that start out with like a 2.5, 3 month program. If it's like a kind of a moderate amount of weight, we have some patients that are looking to lose a significant amount of weight. So it's we have them consult with one of our providers. They'll determine, okay, based on your goals, we'll recommend starting out with this size quantity. And here's the thing: the semaglutide is one of those things where it's a unique peptide medication that when you start out, you take a smaller dose to get your body kind of acclimated to it, used to it, because in some individuals, it does trigger some degree of nausea, and so you kind of
Mm.
want to like start slow, get your body used to it, and then as you progress month after month, you can increase it. And so that's why we want to determine where to start them, how much they're looking to lose, but also we monitor you and kind of get feedback, and it's very individualized. There are companies out there that make semaglutide that it's very set dose amounts, and so
Mm.
you just kind of go from 0.25 milligrams, for example, to zero point 0.5 to 1, and these people are, I mean, they're like having nausea, but we're able to control it how we want. And so I think that's why we get a little bit better results. And it's like I said, it's an individual basis, but yeah, it's really whatever your goals are, we can keep you on it to get you really getting to lose weight and continue to lose weight. And people are just loving this stuff because it's like I said, it's oftentimes these are individuals that have like tried everything, yo-yo diets, and gain it back, and this is like the one thing that's been a game changer for a lot of these people.
Okay, awesome. And then selfish question: I want to get a 6-pack. Can I start doing semaglutide? And would a client like me, for example, who's in good health, but maybe I want to optimize, maybe I want to
Mhm.
shred a little bit, could I do that temporarily or
So,
beyond? What
so,
do you think?
so
What are your thoughts?
So someone like you, I think where you're at, like with your physique and stuff like that. I think someone like you may benefit a little bit more from like the HGH peptides.
Mm.
So, which something like a ipamorelin and maybe CJC 1295 with ipamorelin or sermorelin. These are growth
Mm.
hormone secretagogs. And what you would do is you would kind of take these at night. They kind of would kind of create that more of a natural physiologic growth hormone pulse that you would experience at night when you're sleeping. And what we've seen is people that just had a patient the other day said he started the growth hormone peptide. He said, "Oh my gosh, I cannot believe how well I'm sleeping. I'm sleeping better than
Ah.
I've ever have." As you know, that's when your body's burning fat, and yeah, a lot of patients notice like they're getting a little more fat loss in their abdominal section, getting the 4-pack and the 6-pack. So that's something I think for you would be great. And
And
that's
Dr.
something.
JC, really quick, growth hormone, because this always gets
Right.
asked.
Yeah.
There's a difference between growth hormone and growth hormone peptides, correct?
There is. So
Okay.
yeah. If you so
Because I've had
the
some guys say, I've been on growth hormone doing anything for me.
Yeah, growth hormone. So oftentimes the growth hormone is reference to like the exogenous growth hormone that you would get prescribed. So it's a growth hormone itself that you would inject. The growth hormone peptide. So it's a little chain of amino acids that you would administer at night before bed that goes and tells your pituitary to then secrete more growth hormone. So it's basically just guiding and stimulating your body's natural production of it in a more
Mm.
efficient manner. Because as we age, especially when you hit 30, you'll start to see that significant decline in growth hormone. And another benefit is when people are on these growth hormone peptides, they'll notice because it's increasing collagen production. So you'll experience
Mm.
better joint like fluidity, better ligamentous health, increases collagen production. So your skin will start to look more youthful. So women love it because it helps with the lines and it helps with all the connective tissue health. So it's a great peptide for a kind of like anti-aging component, but also gets you nice and lean and looking good for the wife.
Yes, yes, my friend. Okay,
Yeah.
cool. Love this.
Yep.
Um, okay. What about any, I'm curious. And then what, can you kind of just say like what you're doing right now? What's the protocol? Here you are, 47-year
Mhm.
old male, dad of 6 kids, entrepreneur, CEO. Like, what's a guy like you doing to be optimized and thrive? Like
Yeah.
peptides,
Yeah.
supplements,
Yeah.
anything that
So
you want to.
yeah. So I guess I prioritize exercise. I prioritize sleep. Um, I try to these are like so I'm starting with like the lifestyle stuff. I prioritize good protein intake. So I think as we age, protein is something that's just that got to keep maintain muscle mass. Now, as
What's
far
By the way,
yeah.
what's your thoughts on that? Because that's been coming up
Mhm.
lately with a lot of the
Yeah.
the people in our circle, the functional medicine docs. It used to be, 0.8 to 1.0 kilograms per pound of body weight. So, for example, I'm 155 pounds. Joel, you should be having about 155 grams of protein at least to stay optimal. But now I'm hearing people say, no, we want to.
Up it.
Here you are. You're saying
Up
maybe
it.
even double. And so,
Yep.
what are your thoughts?
Double. Yep. Yeah. So I'm more here's it's like based on your lifestyle. So you're active. I'm active. I want to maintain muscle mass. I feel like the grandmas, the older individuals, should even eat more protein because it's so detrimental. It's important for them to maintain muscle mass. So yeah, 1.3 to 1.6 grams per kilogram of body mass, body weight is where I'm after
Yeah.
for protein. And absolutely, so that's I'll do I'll eggs, good healthy protein sources, meats, fish, uh protein shakes. I mean, it's just to me, I feel better, I feel more satiated, keeps the body fat down and all that good stuff. But yeah, get your protein in. That's and then for me, I keep my testosterone levels optimized. I love BPC 157. I've had a lot of injuries. So in my aspirations for world record breaking, I've injured my shoulder a few times, and I like it's like good as new from good old BPC
Yeah.
157. I kind of cycle on and off the growth hormone secretagogs. I love CMAX for the mental.
I gotta
So
try that. Yeah.
being co-founder of this company, entrepreneur. I mean, it's like I really want to keep my brain working, and stay sharp for my patients and serve others. And so CMAX is great for that. Um, I love NAD. So
Mm.
NADs, if you don't know, that's a compound that's great for mitochondrial function. So optimizing energy and that kind of thing. I'm probably missing some other ones that I kind of cycle on and off. I mean, there's a lot of great peptides you can look at on our website, blokes.co. And I mean, I pretty much have patients on, or myself on one or two of those at all times. So there's peptides for libido specifically. There's evidence that shows that um, low dose daily Cialis or tadalafil is great for naturally increasing testosterone levels, as well as helping with provides cardioprotective benefits. So I mean, this is what we're all about, reading, following the science, and applying it. But at the foundation of it all is nutrition, sleep, exercise. Everything else is just icing on the cake. So
Yeah, beautiful, man. I love that. One question I was going to ask you, just in your thoughts and just the people that you talk to. Then there's the concern with the anti-aging crew that you have all this protein, you're increasing IGF-1. That could be that could be going against aging for a long time.
mTOR, yeah,
Yeah,
right.
increasing mTOR, and therefore
Mhm.
you're growing too much. If you're growing too much, you might be growing cancer too much.
Correct.
What
Yeah.
do I talked to Rob Wolf about this not too long ago, and he's like, this is all bullshit. And I thought that was
Let's go,
fascinating because Rob
Rob.
knows his stuff,
Yeah.
and he said, I think, Joel, he goes, one of the biggest detriments, he said, now he's like, is that this whole and here's a guy who's done keto and stuff. So he plays with everything, but
Yep.
he's just said, hey, I think in 20 years from now, we'll go back and look at this and say, this intermittent fasting thing was bullshit. Which I thought was, I mean, I do see the benefits of fasting, but I think what he's driving at is fasting works when you're doing like 3 days or, 36 hours, 72 hours, maybe even like a 24, but to intermittent fast the 16/8, he's like, you're not doing
Right.
it's hindering you. I don't know. What are your thoughts?
Yeah, I think looking at all the literature, taking all that in. I mean, and I've done keto. I'm a guinea pigger at all this stuff. I've done keto. That's what I use that to get right. I did a bodybuilding competition like, gosh, what year was it? It was probably after I hurt my neck and I was feeling better. I was kind of like, oh, I'm getting kind of, I was kind of fat and flabby, and I was kind of embarrassed. So I just went hardcore keto, got really lean, did a competition. But then that's when I was like starting to do the heavy weights and everything. Intermittent fasting, I did it for a while. I noticed for me cognitively when I wouldn't eat breakfast, I just felt like sharper, more clear. But I think to your point, a lot of this stuff has to do with more insulin resistance and more the inflammation.
Yeah.
That's caused by the poor standard American diet. If you're eating good healthy sources of protein, yes, you're activating mTOR, and yes, you're causing muscle growth, but you're also getting a break when you're sleeping, and if you're fasting when you're sleeping. So your body, just listen to your body. I mean, I like to now follow that kind of,
More
I
the
guess,
intuitive sense, kind of,
yeah,
right?
I kind of follow. Yeah, and I kind of follow that. I try to focus more eating bigger breakfast now. Where before I was like skip and then a medium lunch and a small dinner. And
Yeah.
to me that's like I feel better, and I feel like if anything, I do feel to some degree like I'm aging slower. I don't know how to explain it. You know what
Yeah.
I mean?
Yeah.
And there is a peptide that we have called epetalon that actually has been shown to lengthen telomeres. So
Yes.
we have stuff available that can help. But I think at the end of the day, doing things like this, I use saunas as much as I can. Probably not as much as I should, but I at least break a sweat every day. So I feel like that is sweat every day, get your body temperature up, move heavy stuff, lift weights, even if you're a grandma, you know what I mean, and up your protein. And man, I feel like this is what we're meant to do. It's like if you're either living or you're not, right?
Yeah. Okay. Awesome stuff, man. I want to wrap it up. I'm going to ask you some lightning round questions, but anything that I didn't ask you that you wish I had?
No, man, I think you covered a lot of good stuff. If I could just like throw one more, I guess, like we statement out there. I really feel like we all have like some degree of inertia happening in us, and we're either moving towards health or moving towards sickness. It's either or, and you just have to decide like where you want that ship to go. Do you want to go towards that island that's paradise, that's health, that's like feeling good, or do you want to go towards the sick island. You know what I mean? So I feel like we're going one direction or the other, and it's all, like I talked about, based on doing that one push up. Start today, do one rep. The next time, if you do two, great, and build on that. But keep it going.
Yeah, so good. I remember I interviewed David Meltzer, who's a very wealthy CEO. I mean, he's at the top of the food chain when it comes to just successful entrepreneurs. Let's just say that.
Nice.
And he said to me when he lost $100 million, he made
Oh,
it all back. But
yeah.
when he lost it, I asked him, like, what was the conversation? Like, what were you telling yourself every day? Like,
Yeah.
I'm a failure. I lost my mom's house. Like, he couldn't, how do I rebuild this? He said, Joel, I told myself, he said he remembered the Rocky 1 movie, and where he's just getting annihilated by Apollo Creed. And he says that scene where he's getting annihilated, but he gets up. And he said, every day I knew that if I just got up and if I could look up and I could get up, I was moving the right direction.
Yeah.
And that's like
Love
what
it,
you're
man.
saying, man.
Love it.
Just take one step, to keep taking that
That's
one
what
step.
it is, man. Just get up and keep moving forward. And it's just I don't know what it is. Sometimes it's fear of not getting what expectation or goal. Like I said before, I didn't think my arm was ever going to be remotely strong again, but I didn't let that like keep me from going forward. So you just kind of like, just keep going. And
Yeah.
you're like, we're working hard in this company. We don't know, like, we didn't know where it's going to go, but we're crushing it and it's growing. We're just like, hey, movement creates movement. So just keep going.
Yeah. Love that. All right, let's jump into some lightning round questions. Don't be nervous, but I'm curious.
Nervous. I'm so nervous.
This is off the script. We didn't even have a script, by the way. But well, I'm curious, like, what are some choices that you think you made that made you who you are today? Or a choice for that matter.
Yeah. Good, man. That's a good question. So there's so many choices. I think it's just not being afraid to take chances. It's like, and not listening to others, because there's so many things that I used to like, run ideas by people. What do you think of? And then everybody's like, well, what da da da. And so I just kind of like, dude, everything's like we talked about. Everything's a test. Don't be afraid to try anything, whether it's business, whether it's health, because it's there's a lot of dogmatic diets out there, and I think people create those because it's like nobody knows what to do. But man, just start. Just don't be afraid to try to and add an apple to your to your diet, right?
Yeah, that's what I say too. Try it, test it,
Right.
and then
Test
retest.
it.
See if it works. Run an experiment. If it works, great. If it fails,
Don't be afraid.
Experiment.
Don't be afraid to try to cut out gluten for a week. You know what I mean? See what happens.
Yeah, love that. You're a pretty healthy guy. Who's someone in the health and wellness world that inspires you?
Yeah, who I've kind of been a fan of for a long time is if I were to go way back, it's been Jack LaLanne.
I love that.
Yeah,
that's amazing.
That's like that's one of my old heroes. And then more from a chiropractic world, Josh Axe is yeah. I kind of dig. I liked his stuff, and that's where I was really, as well as Dr. Hyman, some of his books and stuff, just in the beginning. But and then it just kind of grew into, like, I have a lot of Dr. Datis Karaji and Dr. All of the functional medicine gurus I'm a fan of, and they're like all pioneers, and I just love this stuff. So
yeah. On that note, any books? I'm a big reader. Are there like a top? By the way, I'm a big reader. I don't know if you can tell.
Yeah, let me see. I have a whole stack too. If I were to say, one of my favorite books, I mean, this is I'll just grab it, is The Daniel Plan. Love that book. Such a good book.
Yeah, why? I haven't read that one.
So it's biblically based, like how to eat to be healthy, and it's just the foundational stuff. I think that's a great book. If I were to
gotta grab that. That's awesome.
Yeah. I'm looking back here. This is another good one. For like more for kind of for business and for is
Killing Sacred Cows.
Another one you haven't. Another good one.
I haven't read that one. God, okay, this is great. I'm glad I asked you this question.
No, another good one.
Here we go. Oh, okay. Yeah, Unconventional Medicine. Yeah, Chris Kessler.
Chris is good. Yeah, so those are three good ones that I have on my desk right now that I'm reading. So,
what about
read actually?
Yeah, Any rituals or hacks or practices that you do on a regular basis?
I don't have any. It's weird. I don't really have like. I'm kind of weird. I'm seasonal about a lot of hacks. I'll do one for a while, like I did the Wim Hof breathing technique for like. I was doing that, and I was getting to the point where I was holding my breath for like a long time and feel the effects of it. And I did that for a while, and I felt like, wow, this is great. But but like I think if there are things I kind of do regularly as much as possible. Hydration in the morning. Every morning, I drink a good, not I don't pound it. I drink water, but I also drink apple cider vinegar. I throw in some lemon juice. Kind of start my day with that. I try to go for a walk in the morning. I'm in Nebraska, so it's not always sunny. We don't always have nice weather, but it's nice now. So I'll get up, go for a walk. I'll listen to a podcast. I'll listen to Joel
The hack life.
or yeah,
Yeah.
I'll listen to a lecture, an audiobook and stuff. It kind of helps get me ready for the day. Uh, and those are some of my routines. But I work out every day. I do usually some kind of like quick resistance training movements in the morning. Um, Usually journal in the morning a little bit for the day. Read a little bit of the Bible, and then go to work. And so that's usually my morning routine. I think that's kind of what gets me set for the day and keeps me focused.
I got to ask you a quick question because you mentioned journaling, and I work with a lot of men,
Hmm.
alpha men, police officers, firefighters, these alpha dogs, and a lot of times in my coaching, I really strongly advocate for journaling, and I
Yeah.
tell them, listen, it's not dear diary, like this is how I'm
Yeah.
feeling. It's not
Yeah.
about that. So
Yep.
I'm curious, and we're talking about being a better man and manning up. What would you say to what do you tell people when they ask you journaling? Like so when what are your thoughts about journaling and why you do it? And is there a
Yeah.
type of journaling that you kind of gravitate to more?
Yeah. Man, I'm always searching for that secret way to do it, or I don't know if there is like but for me, it's kind of like what I want to get accomplished for the day, and I'm not like making a, sometimes I do make a long list, but I don't want to set myself up for failure. You know what I mean? And so sometimes I'll just say, these are 3 things I got to freaking
Yep.
knock out today. And I know if I do them, I'll feel like, okay, I freaking, at least today was a win or is going to be a win. Just to kind of like get myself focused on what needs to be done. So that's kind of like the type of journaling. But then I kind of like to write down, things that I'm kind of grateful for.
Mm.
1 or 2 things, and that's kind of the things I focus on, and it just kind of gets me in that right state. But and then I look back and for accountability purposes, like yes, 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 and it just keeps you moving in that constant, like kind of like winning direction kind of a thing. It's not every day is going to be a win, right? But it's more for accountability.
Yep. Love that, dude.
Yep.
Last but not least, man, where can people find you and the good folks at blokes.co and Joy Wellness?
Yeah. So we have a couple websites. So the Blokes website is Blokes BLOKES.co. You can go there, and you can kind of like, if you want to schedule a consultation, you can do that. It's pretty easy. You can also just kind of browse through, see what we offer. And Joy is choose Joy, which is JOI.co. So that's where you can go.
Awesome, man. And then you know what I'm thinking too. We might have to come when we do a part two. We
Yeah.
might have to come back on and talk more just specifically geared to the ladies. I think that might be a cool
Yeah.
podcast to really just dive into their health and wellness and what you guys are doing at Joy and what you guys are seeing there. That might be kind of fun.
Yeah, I agree, and it's the thing is I'm actually more partial to the ladies. I mean, for being practicing functional medicine, I'd say like 80% of my population, my patient population, has been ladies, been women. I'm a girl dad. I'm very, I'm very
Yeah.
in tune with what with women and with females, and there's such a need for it. And it's amazing when you get if a guy figures out the woman and figures out the hormones and gets it dialed in, that dude will win the Nobel Prize. I mean, that's just,
Yep.
and
Yep.
we're chasing it, man. We're driven to take that challenge on because there's such a need, and it's just they're I feel like they've been very underserved, especially from that women's health initiative study. It kind of like threw threw it under the rug, like, hey, let's don't do hormones for women. But it's starting to gain traction. So I'm excited. Yeah, I'm excited to do that, and would love to.
Yeah. Awesome, brother. Thanks for being on the show, man. I appreciate you.
Thank you, brother. Appreciate you.